Hi, my name is Mike Hartman. I'm an oral surgeon in the United States, specifically in Pennsylvania. I've been working with Relu for the last year and a half now, and I got an email from them last week asking if I would do a testimonial, answer some questions for them, and I said, sure, I can do that. So let me read off the questions here, and I'll try to answer them to the best of my ability. What do you use the Relu Virtual Patient Creator for? So the Relu Virtual Patient Creator is actually the cloud-based platform for Relu, where you're able to upload your data acquisition, such as your cone beam CT scan, intraoral scans, so forth. And through their AI-powered software, it allows all these images to be aligned accurately, as well as the cone beam CT scan to be converted from its DICOM type file format into a rendered or STL file format, which you can then export out of that software to use really any way you see fit. I would hate to pigeonhole, or I would hate to tell the viewer at this point a specific way that you can use these segmented structures, because that's really one of the great things about this product. It just gives you the segmentation in an AI type manner. What did it change in my workflow? Well, in my practice, we do a lot of dental implant surgeries. And when we get into our larger full arch surgeries, a lot of times we need the ability to segment our cone beam CT scan into an STL file format, whether that be to design bone boring guides or other type implant fixtures. And sometimes we even use these segmentations then to 3D print, perhaps if we're doing some sort of surgical simulation or sort of trying to do some sort of surgical training. This is where the ability to segment those structures really has changed our workflow significantly, as opposed to being able to do this in a manual type fashion in other static guided dental implant softwares, where my technician would spend maybe 2 hours going through slice by slice of the CBCT, sort of defining what is bone and erasing what is not bone, and coming up with, say, the mandible or the maxilla. The true beauty of the Relu software is it does it automatically. And quite honestly, I've timed this a couple times now. The time from upload to segmentation is usually about 12 minutes. So it saves a significant amount of time. It saves a significant amount of man hours to complete this segmentation. And honestly, I think the results that we've seen are more accurate than what we've been able to do in a more manual type fashion. And it's really great because Relu brings this to you at a really affordable sort of click fee price. You pay per export. My favorite feature about the software, again, it's going to be this auto segmentation feature. I will tell you what was really nice and has made a big difference in terms of convenience is when we have these intraoral scans and these cone beam CT scan, we upload this, the software aligns the intraoral scans over the CBCT. At the same time, it segments out the CBCT into the STL type file format. When you export this out, your intraoral scans are already aligned according to your CBCT scan position. So I actually found this by accident. To be honest with you, I'm not that smart. I had uploaded then my CBCT folder, which also had my Relu segmented structures in it, into a dental implant treatment planning software that we use. And what surprised me was that the software recognized those STL scans and imported them automatically into the correct position. So again, this was a time saver that I wasn't even really expecting the software to do for me. Now I didn't even have to go through and import these structures item by item. I can just now put all of these in one folder with the CBCT, upload those into the static guided software, and then the software brings them in automatically. Again, a great time saver. What features do you wish to see in the future? That's kind of a tough question. I think this software is so cutting edge right now in terms of the ability that, in terms of the technology that it's at, and in terms of what it's giving us, is kind of hard to tell what's next. I feel like this feature is something that we in the dental implant business or the dental laboratory business have been looking for a long time, and sort of putting that at the top of our wish list. And now that it's here, I don't know what to say is going to come next, to be honest with you. I will tell you the new beta version, or the new beta feature in the software, where you are able now to accurately segment out the base of the skull, is very intriguing. I don't know where that will lead. I think it will lead to perhaps even bigger usage outside of practitioners, say in dentistry, perhaps into the fields of neurosurgery, where they may have the ability now to accurately segment out base of skull, perhaps print these patient-specific models, and allow them to do some sort of simulated surgery before then they're actually performing their real surgery on the patient. So this may play on a certain level into resident training and outside fields of dentistry in and of itself. So the case that I really wanted to showcase for a number of reasons is that of a case that I actually performed. It was a dental implant surgery that I performed using the X-Guide dynamic navigation unit. And what was unique about this case was the treatment plan called for extracting the lateral and premolar tooth, and as you notice on the segmented scan here, we have an impacted canine tooth. Now, as this patient was older, I felt that the best course of action would be to leave the impacted canine and perform our osteotomy and implant placements in a transdental type manner, especially when we place the lateral. So what I did in this case was I uploaded my CBCT into the Relu software, and I segmented out the maxilla and the corresponding maxillary teeth. And what I did then was I virtually extracted the lateral and the premolar, the two teeth that I had planned to remove at the time of surgery, and then I exported out as one file the remaining maxillary teeth with the roots. And what I did then was I brought that STL file into my X-Guide treatment planning software, and I aligned that onto the patient's CBCT. So instead of using, say, a patient's maxillary scan, instead I used the patient's segmented crown and teeth from the Relu software. And what this did, in my opinion, was it allowed me to visualize with better accuracy just where my planned implant osteotomy was going to be in relation to the canine teeth. And then you'll see here there's a segment of the surgery showing the dynamic navigation monitor as I'm creating my osteotomies, and notice how the drill bit is going sort of in that transdental fashion, just as I had planned before the surgery on the patient's virtual treatment plan. So in and of itself, this isn't a huge breakthrough, but again, these are the finer things or the nuances now that auto segmentation is allowing us to do. Because previously I would have never done this. This would have taken hours and hours of my life to accurately replicate or segment these crowns and roots of the teeth, and it wouldn't have been worth it. But now with this new software, with this Relu artificial intelligence powered software, things like this are very easy to do. And at the end of the day, these are going to allow us to achieve better patient outcomes, better case outcomes for our patients, because we're able to leverage the power of this digital technology and now this new influx of AI technology on top of the dental digital technology to, again, do what we always try to do as providers, as healthcare professionals, and that is to optimize our case outcomes.